Hi, my name is Sandra Hudnut, and this is a short video on ethics in profession for Central Methodist University, a case for professionalism in nursing. Merriam-Webster has described professionalism as a person who has the skill, good judgment, and polite behavior for a person who is trained to do job well. One of the ways we can have the skill is by going to classes and by earning our degrees. We have a lot of tests to do, and we are put in clinical situations, shadowing our to-be comrades in nursing, and to learn from them what we need to know. And that would be the skill. And then we take a test at the very end, and we are given our registration for being a nurse. Good judgment is one that if there's something wrong with the patient and something needs to be done, then we get a hold of the physician, or we do what we can do within our scope of practice before we get a hold of the physician. And a polite behavior is making sure that we acknowledge everybody that comes along, and we acknowledge our patient as who they are, because we would like to be treated with polite behavior as well. Michael Bayless, who is a post professor at Florida State University, and he is a professor in philosophy, deemed that there is no real term for professionalism. And he likened professionalism to people with degrees. For example, if you were a chess player or NBA player or a garbage collector, he didn't consider that to be professionalism. You might be in this profession and be very proficient at it, but it would not make you a professional. With that being said, I know a lot of people who are very proficient and in their profession, and they do not have a lot of degrees behind their name, that are a lot more professional than other people, and that have a lot of degrees behind their name. This is something we as professionals have to be very conscientious of, because just because we have a degree behind our name does not mean that we are professionals. Much like an onion, yes, I said an onion. When we look at a baby onion, there is just this little teeny tiny core, and on the outside of it there's the skin that looks like an onion. It looks very much like an onion, and it smells like an onion. But it isn't until that onion grows and keeps on growing and incubates and keeps on growing that we realize that just because we looked like a professional to begin with didn't really mean that we were a professional. And it wasn't until after we grew, much like the onion grew, that the layers that we find in the onion are just like the layers that we find in our own professional life. Excuse me. There was a study done at Wells, in Wells, that talked about professionalism, to where they felt that professionalism was very fluid. Being professional is very fluid. To have that it's always moving, and it's always growing, and sometimes it goes into a small stream, and sometimes it goes into a large river that leads out into a vast ocean. They found that professionalism did not come from the clothes that you wear. They found that it made no difference whether you had a uniform or whether you had a suit, whether you were professional or not. What it came from was the personal qualities found within the individuals. It came from the attitudes, the behaviors, the outcomes, the integrity, the humility, the caring, and the striving to build therapeutic relations that challenged and empowered others, while we ourselves took accountability for our actions. Taking accountability for our actions is huge in a profession. We must make sure that we have our actions that are accounted for, that we own them. We need to make sure that when we're working with our patients, we have up-to-date information by our evidence-based information that we give our patients. Some of the moral Things that can be lost is just in general the morality of being a professional. We get so wound up in what our life determines we need to be that maybe we forget why we're there, and we want to make sure that that deep in our core we are very moral. We do not want our morality to go out the window by the things that we need to do and the things that we think that we need to do for somebody, and have it fall into a great abyss. For this, we might end up, and our patients might end up at death's door. And we want neither one of those things to happen. There are some of the ethics that we looked at in our class, and there are two specific genres of ethics that I would look at today, and that would be the utilitarianism, the feel good, if it feels good, do it type of mode. You can't do that in nursing. If you have a difficult patient and you just want them to go to sleep, you just can't give them a pill to go to sleep. That would be unethical. It would feel good to you, but it wouldn't feel good to the patient. If you've got somebody that is always getting out of bed and they don't need to be getting out of bed, you just can't tie them to the bed. That would be unethical. That is just something that you just can't do. And you would lose some of your morals if you were to do that. But because nursing is not a feel-good profession, it is, in my opinion, a social contract. We have make a contract with our governing bodies as nurses to take care of our patients the way that they are supposed to be taken care of within the rules of our governing bodies. And although we do not actually sign a piece of paper, we make a contract with the people that we work for in order to take care of their patients the way they would like us to take care of them. So between our governing body that we do have a contract with and the body an entity that we work for, between those two governing bodies, we have a contract that says we will take care of the patients as you want us to take care of the patients, and as we know is morally good to take care of the patients, using our good judgment and our skill set in order to honor our profession. We as nurses are taught to respect human life above all else, because human life is sacred. And this is absolutely true. By being accountable for our actions, this is one of the ways we do it. Now, the scenario I was presented with was two nurses that were having an ethical dilemma of working without being paid and wanting to be able to get ahead, but not being able to work without being paid. This is an ethical dilemma, and one that a manager should take hold of right away, because it is not right to work without pay, according to the Fair Labor Standards Act. So in the end, the manager should take a hold of this and make it right. That way it left all doubt to be erased. I thank you very much for your time, and I hope you have a good day.